Your heart is a muscle, and rightfully so, as it's got a big job to do to pump blood and oxygen around your body. And just like any other muscle in your body, if it's working harder, it becomes more muscular. Your heart muscle responds to high blood pressure by thickening and getting bigger. A muscular heart is a heavier heart. The medical term for this process is called hypertrophy, and in high blood pressure, we see this in the left ventricle, the chamber of the heart responsible for pumping blood to your body. Left ventricular hypertrophy is important in that it's a sign that your heart is under stress. When I see this in patients with high blood pressure, I know it's now not just about treating a number, but treating a process. Left ventricular hypertrophy is associated with worse prognosis. This process increases your risk of having fatal events, such as a heart attack, and may also lead to heart failure, where the heart actually becomes less effective and unable to meet the requirements of the body. It's also associated with higher incidence of stroke, heart rhythm problems, and sudden death. The most common cause of left ventricular hypertrophy is high blood pressure, but there are other conditions that also cause this process, such as valve disease, in particular aortic stenosis, and inherited heart conditions such as hypertrophic cardiomyopathy. So why is a more muscular heart dangerous? Firstly, the heart has its own blood supply. A more muscular heart will therefore have greater demand, and if it's not being met, it can cause damage and scarring in the heart. A more muscular heart is also a stiffer heart, needs more time to relax. Before each contraction, the heart needs to relax to fill with blood. So if the heart isn't filling properly, then it won't pump out adequate amounts of blood after each contraction. As a result of this, the heart gets progressively weaker, causing heart failure. But it's not all doom and gloom. The good news is that this process of left ventricular hypertrophy in high blood pressure can be reversed in some cases, and the reversal improves prognosis. So how do we reverse it? Well, lifestyle is most important, and I've done a separate video on this, which I will link to on the screen. Lifestyle changes are essential, but the effects can take time. When I see left ventricular hypertrophy in the context of high blood pressure, I have a low threshold for starting medications to lower blood pressure. And it's important to spend some time explaining the rationale for this to our patients to improve adherence and compliance to treatment. So the take-home message is that the heart muscle adapts to high blood pressure by thickening, and this is a sign that treatment is indicated, both lifestyle advice and in most cases, drug treatment. I hope that was helpful, and thanks for watching.